Well, meanwhile, a research team in Southampton has started new clinical trials to test whether a diagnostic tampon could detect ovarian cancer. In the UK, more than 7,500 women are diagnosed with it every year, making it the sixth most common cancer among women. If caught at the earliest stage, survival rates can be as high as 95% for 5 years. But if detected late, then the survival rate for 5 years can drop to as little as 15%. Well, a team at University Hospital Southampton is looking to speed up detection and get treatment started earlier than ever before. A little earlier, I was joined by Dr. Jemma Longley, who's a consultant medical oncologist and is leading the trial, along with Dr. Alison Farmer, who was diagnosed with ovarian cancer when she was 40. And I began by asking Jemma what difference this test could make.
What we do know is that cancer cells can secrete little genetic material that then can come down the genital tract and potentially be picked up in vaginal fluid. As there's no screening programme for ovarian cancer currently, and a lot of women are diagnosed at an advanced stage, this is a game changer.
This isn't something that can be detected in a smear test when you're looking for cervical cancer.
That's correct. No. So when you go for your smear with a speculum, they're looking for cervical cancer. Ovarian cancer is higher up in the genital tract and more difficult to spot.
Alison, you have been diagnosed in the past with ovarian cancer. Yes. How did you learn about that? How did you find out?
I had a little bit of very subtle mid-cycle bleeding, which I knew wasn't normal. That's not a common symptom of ovarian cancer, but it can be one. The most common symptoms are persistent bloating, feeling full very quickly after eating, needing to wee more often, and abdominal discomfort. Ovarian cancer was often called the silent killer, but I think it's really important that women are aware of the common symptoms.
Why is it, do you think, that sometimes these symptoms aren't picked up?
There are a number of factors. Women tend to be extremely busy at that time of their life. They often think it's a menopausal symptom because most commonly it's detected between about 50 and 70. Or irritable bowel syndrome. All sorts of things can make you feel bloated and unusual. And I think Jemma and I would urge any woman who thinks that there's something different going on to seek medical advice as soon as possible.
It's something that can be done in your own home as well, isn't it?
Yes.
How important is that? What difference does that make?
I think that breaks down a lot of barriers for women. So, you know, it may not be acceptable for some groups of women to have an intimate examination from somebody. It's pretty uncomfortable. It expands this and makes it accessible to different groups of people. As Alison said, you know, we're busy these days. You know, we've got families, we've got elderly parents.
I'm surprised this hasn't been thought of earlier, in a way. Could it be used to detect other conditions or other cancers?
So we hope to expand the trial outside of ovarian cancer and include endometrial cancer as well. It potentially could be used to diagnose other conditions. The tampon itself is validated for HPV screening already. So yeah, it's exciting because I think, you know, we don't know very much about female biology. There's been a lack of funding into women's health, and we're here to change that.
I was going to say, what happens next? This is obviously a small-scale clinical trial. Where do you go from here?
So we're hoping that we can get some further support to open this out to sites across the UK, and so that we can include lots of different populations of people across the UK and not just from Southampton. Well,
we shall follow it with interest, and hope you can come back when the trial's expanded and we can hear more about how the test results are going. But all the best.
Thank you very much.
Thank you very much, Jemma and Alison. We appreciate you coming in today.
Thank you.